Hi, I'm Anthony Ghosh, a consultant spinal neurosurgeon, and I'm delighted today to be talking about over 50s back and spine problems with a very well known physiotherapist, Will Harlow. He's got a massive YouTube channel. There's a link below. I suggest you check it out. So, Will, it's great to have you here. Can you start by telling us a little bit about yourself, what got you into physiotherapy, and particularly with sort of over 50s and back problems?
Yeah, absolutely. Thank you so much for having me, Anthony. I'm really looking forward to our conversation today. So, as you say, my name's Will Harlow. I'm a physiotherapist from the UK, and I've been qualified just coming up 10 years now. And like many young physios, when I first started, I thought I wanted to work in professional sport. So, my specialism now is in people over 50, as you say, but that wasn't always the case. And I very quickly learnt after landing a dream job really in professional football that that path wasn't right for me. So I had a very early realization really that I'd been planning for this thing my whole life and I'd got it wrong. So I had to make a pivot. I moved into the NHS for a bit just to kind of figure out what I wanted to do. And after a few months of working in the NHS, I realized that actually this is the most fun I've had in a very, very long time. And I look back on why that might be, and it was because I was treating people mostly in their 50s, 60s, and older,
Yeah.
and helping them with their mobility and their independence. And I was loving every minute of it. There was just something a little bit more rewarding about the results you can get for someone who, is struggling to walk or, can't get off crutches. And if you help them achieve their goals, there's just so much more rewarding than, getting Johnny age 25 back onto the football field, for me anyway.
Yeah, I completely agree. Because that's the age group where we start to have trouble with mobility, and I think if you can get someone mobile again and doing things they enjoy, that's really rewarding. What are some of the biggest challenges that you've encountered in that sort of age in that population, particularly with sort of chronic back pain?
So there are lots of unique challenges to helping people in 50s and beyond. And even in that age demographic, there's a huge spread of abilities. And someone in their 50s is obviously very different to someone who's in their 90s. So even among the decades, there's big differences. One of the big problems we see is, and this is not just relevant for backs, but for all areas of the body, is that people are often under the impression that because of their age and they've got an ache and pain, that ache or pain is now just due to the fact that they're getting older and things are wearing out
Yeah,
and that there's absolutely nothing they can do. And their two options are either to accept it because everyone else has told them that that's normal and there's nothing they can do, or to opt for surgery. And I wanted to basically fill the gap in the middle of the market, which is like there's so much that can be done between those two extremes.
yeah,
It's just not that well known about. And quite often we see, and this is especially the case for back pain, that aches and pains are not just due to something wearing out, but are more due to mechanical problems or issues with the way someone is moving. Something's become too tight or too stiff or too weak. And if we can fix those underlying mechanical problems, quite often the symptoms can improve. Now, in terms of challenges, the physiotherapy profession has been through quite an evolution in the last few decades, and we've started to really embrace something called the biopsychosocial approach,
yes,
which is a combination of three words really. And the first word, biological, really relates to physical problems with the body, so pathology and the kind of mechanical problems that I just spoke about. Now, we've started to realize that that is only 33% of the problem. It's only a third.
yeah,
You've got these other two factors that can be big drivers of painful issues. You've got psycho, which is psychological, and that is someone's beliefs, the way their brain processes the pain, the way they approach movements and their attitudes towards, the way they move their body or the way they exercise. And then finally, social. So this is, their lifestyle, the way they live their life, their job, what they do at home in their spare time. And these things are equally as important as the way someone moves. So
absolutely.
when
Yeah,
when I was training 10 years ago, we focused a lot on the bio and a lot less on the psychosocial.
yeah, yeah,
So the biggest challenge for me personally has been trying to integrate that approach, that three-pronged approach into everything I do with my patients and kind of
Yeah.
teach people that stuff is just as important as the physical.
Absolutely, and that's really important in all areas of medicine. So, I often say, for the exact same illness or the exact same disorder, how it affects one person based on the psychological aspects of their lives and the social aspects is going to be very different. If I treat for the same condition, stenosis, for example, we commonly see in this age group, someone who's keen on running marathons versus someone who maybe just enjoys a walk in the park with the grandchildren is going to be a bit different. So
Absolutely.
in terms of like the age groups, as you touched upon, the over 50s, I find especially in the surgical world with the spine, in the sort of younger quarter of that, the sort of 50s and 60s, there's a lot of overlap with what I see in much younger patients. So, for example, if we've got a human spine here, the disc, the little cushion between the two bones, in a lot of the younger patients, it's much softer, and then in certain movements or certain things they do, it can cause tears and herniations and then nerve compression. Whereas and then in the older population, say over 60 or 70, that's when you start to get stenosis, narrowing of this tunnel, this canal through which the nerves run as everything starts to thicken up. But then in that younger group, you get that as well. You get that sort of overlap between the two age groups. And again, exactly as you said, the different things they do, different hobbies, different interests they have, and beliefs massively affect the way we treat them. Um, for your patients, how do you approach that sort of? Do you believe in a sort of because of what you just touched upon? Do you have a sort of personalized treatment plan? How do you approach that?
Yeah, definitely. And going back to what you said there, every single patient is different, and especially in back pain, I often think of it as similar to how I think of golf. Okay, and I don't know if you've ever been a golfer, Anthony, but it's one of those sports where you might go down to the course one day and you have an amazing round, and you think, I've cracked it, I've figured it out, I'm really good at this now. I know what to do exactly next time I come back and play. The same is true with back pain. You might have one patient where you figure out exactly what's wrong, you give them what you think is going to help them, they come back, they're like, that was amazing, it works super well, and you think, oh, I've cracked back pain, I know exactly how to treat it. But then the next patient comes along, you try the same approach, thinking that it's going to work just as well, and it doesn't.
Yeah,
So it's a very humbling thing to work in. And it's one of the reasons I like it, because it keeps us on our feet,
yeah,
on our toes even. Now, in terms of a personalized approach, or an approach I take with my patients, I will always start off with finding out a lot more about that person, and specifically what their goals are
yes,
or their concerns.
yes. So
And I think
patient
those two
goal
things are
orientated approach. That's what I believe in. Yeah,
super important. And we find that someone might have a goal, like, I just want to be able to walk further with my partner. Okay, fair enough. But some of the biggest motivators for coming to get help are a concern. They might have had a family member who has had back pain for a long time. That family member ended up having surgery, and it didn't go to plan. And now that person is not as capable as they once were. And the patient is looking at that thinking, I don't want that to be me.
yeah, yeah,
So I think finding out those concerns and those goals up front is super important. It's integral to everything we do. And once we've got those goals or concerns, the next thing I'll always try and do is assess the mechanical aspects of how that person moves. Just as you say, you've got various aspects of the body which can influence the back. And you've got weakness in some areas can cause extra stress on the back, or tightness or stiffness in others. So we want to find out what those things are, and then see if we can fix them. Now, going one level deeper, we also want to assess the person's beliefs and their kind of the way they approach their back. And
yeah,
sometimes fear of movement can be a huge factor in stopping someone from getting better. I've had a really memorable patient recently who was a guy who is in his early 50s, and he was a keen golfer, and he stepped up to the first tee one day, swung his driver, instantly felt this horrendous back pain, and this pain shoot all the way down the back of his leg, and had an MRI scan, and it was a typical L5S1 disc herniation.
typical in golfers, isn't it? That level. Yeah,
Absolutely. Now, when he came to see me, his pain was getting better and we treated him and his pain eventually resolved. But he still couldn't pick up that golf club again. He was terrified.
Yeah.
He was, for all intents and purposes, fixed because the pain was gone. And, I was like, you're moving beautifully. But the minute he held a golf club in his hands, he was like, I just can't bring myself to start to rotate to swing because I'm so scared of what happened before. So sometimes with back problems, it's not just the physical, you almost have to unpick those traumatic events and address those fears and beliefs that someone has picked up, quite rightly, by the way, because of what's happened in the past.
Yeah.
But obviously those beliefs can start to get to a point where they really get in the way. Like this guy really wanted to get back to playing golf, but he had that mental block that stopped him from getting back to it. So the bulk of our work was actually working on his beliefs and showing him it was safe to do those things. And eventually we did get there. So it's a very, very important factor.
Yeah. And there's actually good research on that because of these fears or abnormal beliefs about, you have this event, you start taking up these behaviors, maladaptive behaviors, they're called. For example, you have this belief that my spine is now weak, I've got to protect it. And there's been a lot of research about the myths about posture, your shoulders back and all this kind of stuff. And then, you find the way people move, they stiffen up because they feel they really have to guard it. And I
Yeah.
suspect a lot of your work is trying to undo that.
Yeah, it's one of those cruel truths where it becomes a vicious circle because the person's trying to avoid a certain movement or posture, they tighten up, and then just the very fact that they've really tightened up to try and avoid that movement makes their pain worse. That leads to them trying to avoid it even more, and on the cycle goes. So you're absolutely right. A lot of our work is trying to unpick those maladaptive patterns.
And my approach is very similar. As a surgeon, obviously, I operate on some conditions of the spine, and it's not. I don't believe in once I've done that and got rid of the pain, that's the end of it. I try and involve in my practice. I try and involve all the different specialists in spine care. And in my experience, if you involve more people in the care, make it more personalised, you get a better result. So it's not just the immediate result. I'm then trying to plug a patient into a sort of healthier lifestyle thereafter. I think the follow-up is really, really important from that point on.
Oh, absolutely vital. Yeah, I think I've spoken to a number of excellent surgeons that I really respect, and a lot of them say that the surgery is 50% of the journey really, and what happens afterwards or even before, the other 50% is made up of the influence from physios and other practitioners and what the person does at home as well. It's all super important. So yeah, it's that myth that I'll go under the knife and things will be fixed. It's like that. You've still got a long way to go. Yeah.
And you need more people involved. And it's not just after. I find with a lot of the surgery, there's a lot of research that's shown that the concept of prehabilitation. So I often get patients to start some exercises, start doing the movements even before they go under the knife, and they get a much better result afterwards when they continue with the physiotherapy. They've already used to doing those sorts of movements.
Yeah, absolutely. We always say that the better you go in, the better you come out. So if you can go into surgery stronger and more mobile, then you're likely to come out of it stronger and more mobile as well. So I totally agree.
Yeah. What do you sort of encourage people in order to maintain, good spine health and, with back problems in patients over 50? What sort of steps do you encourage people to do?
It's a great question. The first thing I would always encourage, and there's tons of research behind this, is to try and get strong.
Yeah.
And
Yeah.
being globally strong is so important for just so many parts of our life. It makes you more mobile, it maintains your independence, but it also wards off pain. And being strong has been associated with less degenerative change over time as well. So there's really no drawbacks to it. Now, when it comes to back problems, being strong anywhere in the body is beneficial, but the areas we particularly look at would be the back itself, the hips, particularly the gluteal muscles. There's some really robust research to show that weakness in your glutes is correlated with a higher risk of lower back pain. The core is a big one as well, and we definitely subscribe to some of the work by Stuart McGill, people like that, about stabilization of the core. And the lower limbs as well. I was doing some research for my upcoming book and found that there's pretty robust evidence to show that any weakness in the lower limb is related to back pain, even as far down as, the calf and the foot. So you can't really go wrong strengthening anywhere in the body. So that's one of the first things we look at. The second thing that people could do to keep their back healthy is to just make sure you're moving it. Quite often we see people come in with lower back pain or back problems, and usually subconsciously they've got into a pattern of keeping their back very stiff and straight. So they're only ever using their hips to bend, or they're never rotating their spine. They're keeping everything super stiff. And what happens over time is your muscles will shorten. The ones that are involved in the movement will weaken, and the joints can become stiff too, which is just not a good combination. So keeping mobile. And you touched on earlier, Anthony, as well, that the truth about posture is that there isn't really a bad posture, but the thing that can make a posture problematic is spending any one time in it for too long. So if you're sat, exactly, being sedentary or sat in any one posture for longer than a few hours, you're asking for things to get shorter and tighter. So just encouraging people to move more and to have less of a sedentary lifestyle. I mean, the final thing I always recommend to people is just do as much walking as you can as well. There's some recent research out there that it kind of makes us as physios question our role in back pain, because it shows that just giving someone a graduated walking program is as effective as sending someone through a full course of physiotherapy. So we know that walking is very effective at both treating and preventing back pain. So just encouraging people to walk as well.
It's interesting you say that, because a lot of my patients ask, should I invest in a standing desk? And I always say exactly what you said. It's not so much that sitting is bad; it's being in that position for too long. And some of the evidence has shown that if you just stand in one place, that's equally bad, because the spine needs to move. So I kind of encourage them, look, just try and get a very regular but short break. Obviously, we've got to get through our day's work. We've got lots of things to get through, but I say just set a buzzer on your phone, or whatever, every so often, that you just get up, take a 10-second, 30-second walk at the most. And it's interesting. A lot of the research, I think we spoke about this before, about Peter O'Sullivan's research about posture and keeping your back straight and all that. It's turned out to be complete nonsense, because it's just about being in one place for too long. And the reason we slouch is simply because that's your back muscles relaxing. That's, you don't walk around with your biceps flexed all day. It's the same. That's kind of the analogy I use. And do you think there's a big industry, isn't there, in gadgets and different things you can buy for back pain, or as we mentioned, standing desks, special chairs, and even these TENS machines and braces and all that. What are your thoughts on all of that stuff?
I think some of it has a place. Like with the standing desks, I'm completely with you on that. I think having a standing desk is not necessarily a gimmick, and it can be helpful, but you're just as likely to develop pain if you're standing all day as you are if you're sitting. A better approach would be to have one of those sit down, stand up desks that can move up and down, and you spend 30 minutes standing, 30 minutes sitting. If that's how you want to do it, that would be more helpful. One of the biggest kind of things that people ask me about in terms of gadgets that comes to mind is the braces that people can wear. I'm not a massive fan of them, and the reason I'm not a fan is because they do support your back very well, almost too well, and that means that your muscles are not engaging. So people often end up wearing them for a time because they feel really good, and then they've worn them for so long that when they take them off again, their core muscles and their back muscles are much weaker, which puts them long-term at a disadvantage. So I would caution against those. I mean, the only time really I would say those are a good idea is if you have a very manual job. Like, let's say you stack shelves in a supermarket, you have to lift because that's your job, and you're suffering a very, very bad episode of back pain, and you need it just to get through your shift. But if you are going to use it, you have to almost make a pact with yourself that once my pain's better, I'm going to take this thing off. I'm not going to use it. So only in very niche cases, I think they're useful. Other things like TENS machines, I mean, symptomatic relief possibly for a bit, but they're not going to fix your underlying problem necessarily. So I know many patients of mine who have used them in bad episodes of back pain and found them useful. But again, if you're not doing the other things around that to get it better long term. It's not going to, fix your underlying problem.
And I think sometimes it adds to that psychological aspect we talk about. You then start to become dependent on this stuff. You start thinking, "Oh, I need my brace," or "I need my machine," and then you start picking up these behaviours. Is there
Yeah.
any activities during, say, a bout of acute back pain or even chronic that you advise against? Anything you advise against?
Um, I don't like too much to advise against things with back pain because it's the case that your back is so stable and safe and it's built to move that we should be using it to all of its all of its available range. Now, I wrote about something in my book which I think is relevant to this, which is the back pain golden rule.
Yeah, there's a
And
link to that below, by the way. For people.
thank you. It wasn't a plug for the book, but it's a chapter in there which is kind of relevant to this, where I found that if you have someone who's got back pain, particularly sort of chronic, very sensitive back pain that gets worse quite easily, if you encourage that person to do an exercise that causes them more pain, the back tends to seize up more. So they tend to get the pain worsens, then they develop a bit of a fear around doing that thing. They start to dread doing their exercises. And over time, they just say, do you know what, this isn't for me, this physiotherapy thing, it hurts too much, I'm not going to do it.
Yeah.
Now, the back pain golden rule is basically choosing exercises that are pain-free when you're having a flare-up of back pain. So trying to find some movement or some direction of motion for your back, or some kind of core exercise or a stretch that doesn't cause you any pain whatsoever, and then come back to it repeatedly.
Yeah.
Now, what that does is it builds up a better pattern in your brain to show you that, oh, actually, I do have movements available to me that are non-painful. It is safe for me to do those movements. And over time, the sensitivity settles down. So it's less easy to trigger those spasms and those painful episodes. So as a rule of thumb, if someone's experiencing an acute episode of back pain, I would usually say to them, just avoid exercises for the moment that make the pain worse, and try and just do things that feel comfortable and that you're happy doing, and then stick to them, do them repeatedly, and keep moving. Back pain is not one of those things where rest usually makes it better. It usually makes it worse, actually.
Even in the
So
acute phase, actually.
absolutely.
Yeah.
And you find that people who've had an acute episode of back pain, they take to their bed for a week, that they're in real trouble when they start to get up and get moving again, even if the back pain itself is improved. So I'm not sure what your thoughts are on that, but I found that non-painful exercises tend to work a lot better for people with back pain than just pushing through the pain, if that makes sense.
Yeah, I think you're right, because I suppose it's the behavioural thing, isn't it? You're probably more likely to not continue with it or not go back. You may not even go back to that physiotherapist. So you want them to continue with the program to get better. So it's about, and that's why I think very personalised care is really important, because often that specific exercise is going to be very different for each patient, even with the same cause of back pain. So,
Totally.
and that's where it's really important that you work one-on-one with your patients. Okay.
Yeah.
Um,
Yeah.
can you think of any memorable cases where any memorable cases of a patient who had severe bout of back pain or chronic back pain even, and you got them through it that you can share with us?
Yeah, there's been lots. I thought of a couple of examples, because they're two examples I've got for you. They're quite different, but they're two cases that I see quite frequently. So one of them was a lady who was in her late 50s, who this was actually in 2021, which is relevant because
Yes.
everything was still very much shut down. She didn't have access to proper hospital care or to a gym or to anything that we do today, just because of the pandemic.
Yeah.
And she'd suffered a really, really nasty disc herniation, again, L5S1. And she'd had an awful pain for months and months. She'd had the whole, the classic can't get out of bed, had to lay down on the bedroom floor for 2 weeks, that kind of thing. Managed to struggle her way to come and see me at the practice. And it was, at the time, it was probably the most severe case of sciatica I'd seen. She had numbness, pins and needles constantly. She had weakness in her plantar flexors. So a really nasty case. And it was a very humbling experience, because we started to make very slow progress. But then if I introduced an exercise that even slightly aggravated it, it was like it was back to square one.
Yeah.
So it was super difficult to make consistent progress. But the thing that really stuck with me about this is that she was so persistent. She really didn't give up on it. She kept doing the things I said, and she kept on doing these tiny little movements just to try and get some blood flow back to the disc and to rebuild the strength. And over time, she did make progress. Now, one of the big lessons for me from this incident was if you introduce the right exercise at the wrong time, you
Yeah.
can still aggravate the problem.
Yes.
So when I first started treating her, a couple of weeks in, I said, well, you've got this awful nerve pain. Let's try an exercise called nerve flossing, which is a neurodynamic,
Yeah.
basically to try and help the sciatic nerve to glide a little bit more smoothly in the tight spaces it exists in. Now, this made her so much worse. The
Yeah.
first week she came back and she was like, I'm never trying that again. It really, really kicked it off.
Yeah.
So we gave it another few months. She got a lot better. And then later on in the process, I said, would you be willing to maybe have another go at that same exercise? And she did. And it was like that was the thing that broke the plateau and got her to 100%. So
Mm.
sometimes it's the timing rather than the exercise itself that makes the difference.
Yeah.
So that was a big lesson for me.
Yeah, that's a great case, and I think that's it. And what you've highlighted there is with sciatica, with slip discs, and a pinched nerve. I often try and encourage patients to say, look, the majority, and the evidence has shown this, the majority of patients, it will get better. I think something like 60% will be better within 6 weeks or just a few weeks. 80%, well within that sort of 8 to 12 week period. So the people I end up operating on to shave away that bit of disc, they've either had the pain for a prolonged period, it's failed physiotherapy. The only reason I would go in early as a surgeon is if they've got an actual neurological deficit, like we're starting to lose power in one of the legs. My job is, to try and prevent that and preserve it. Um, what is the one thing you wish everyone knew about back pain and its treatment?
One thing. I think the one thing I wish everyone knew about back pain is that there's a very poor link between the pathology that we see on an MRI scan and the pain that someone feels.
Yes.
There was a real seminal paper in, I think it was 2014, which took 1,000 people off the street. They didn't have back pain. They put them all through an MRI scanner and they found pathology in about 80-90% of these
Yeah.
people. Almost everyone had,
Yeah.
yeah,
Yeah.
everyone had a disc bulge or facet joint degeneration or, spondylolisthesis. Some people even had a fracture.
Yeah.
And none of these people had any back pain. And that kind of called to question everything we'd believed about everything just being driven by pathology. I try and share that paper with many of my patients who've got back pain and they've had a scan and they say, well, the scan says, I've got this
Yeah.
disc problem. Doesn't that mean, I'm screwed? Basically, it's like, not at all. And we can't even be convinced that that is the thing that's causing your pain. And I think that's just a really reassuring thing to know, that it's totally normal to have these aging changes on a scan. Someone once said to me that you can think of them more as wrinkles on your face rather than a disease.
Yeah.
And I quite like that as a reframe, because wrinkles, unless you look at them, they aren't painful.
Yeah.
So it's just a really important message, I think, to get across to people that these changes on a scan are not your destiny. And even if you do have things on a scan that look seemingly terrible, often with the right treatment and the right approach and fixing the underlying mechanical problems and the way you move, the symptoms can dramatically improve, even if the pathology itself doesn't get better.
I mean, I did a video a while ago called something quite provocative: the catastrophic effect of MRI scans on back pain. It's all about that very paper.
I love that.
And the reason I did it is because now, especially today, patients can literally walk into an MRI scanning unit without a referral, pay for a
Yes.
scan. Radiologists do their job; they have to report it in detail. But when you read that report, they freak out. And I often spend a lot of my consultation saying, "Look, this A4, these two sides of A4 are describing what's very normal in your age group." I think something like 68% of people above the age of 50, 68% without back pain will have at least one dehydrated disc. One of these discs looks a bit dark on the MRI scan, and that's a perfectly normal finding. It's funny you
Absolutely.
mentioned spondylolisthesis. We're talking about sort of personalised care. I had a lady who was a marathon runner. She was in her 60s, had run 25 London marathons, and she had this ambition to do 26. So one
Wow.
marathon for each mile of the marathon. She came in with back pain and leg pain from stenosis, from bilateral leg pain, and she had a bit of a spondylolisthesis, where one bone slips forward like this, and it causes a narrowing of the canal. But it wasn't unstable at all. And I said, so look, that's probably been there for many, many years. I did some dynamic X-rays on her, and it didn't move at all. And she'd been told she needed a major fusion, and she had the marathon coming up, within a few months. And we managed to just do a simple decompression, but I worked with a physiotherapist to make sure that she didn't lose any strength in the muscles that surround that. And she was fine. She didn't have any back pain. She got through her 26th London marathon. So
Fantastic. That's such a good success story when someone has like a big ambition like that and you can help them get through it. It's a great feeling.
I think that's what's kind of my thing is again keeping people moving. The things that I find rewarding are getting people back. I like treating active people, and then I like eliminating these abnormal beliefs. My spine's now ruined because I've got degenerative change. I'm like, actually, this is the most robust part of your body. It's the center of your skeleton.
Yeah.
So finishing up now, sort of anyone who might be dealing with back pain, what's the first step you would say towards them getting to their recovery? They've been dealing it
I
with
think,
quite some time. What would you suggest?
yeah, if they've not had any help yet, I think the first step would be to find someone you trust to get some trusted advice and some guidance on what to do. Especially if you've had it for a long time. Back pain can become quite complex quite quickly. Not in the case that lots of pathology is happening, but because if you develop these fears or these funny movement patterns, it can be very difficult to pick those up yourself. And sometimes it takes a trained professional to have a look and say, actually, you're not quite moving right. And you've started to do this funny compensation thing. Let's see if we can fix that first and see what happens to your pain. So if you haven't been checked out and you've been trying things and you've been following YouTube videos and things and it's not helping, I'd say the first thing to do is to find someone you trust to get some advice and then follow it and see if that really helps. Now, if you've already done that and you're making some progress, but you want a little bit more, for most people, just keeping moving is such good advice. It's so simple and it just sounds so generic, but there's tons of research about walking and changing positions and resistance training and strengthening. All of these things can help. And when I was doing some research for the new book, I was looking at papers about certain types of exercise and how much they help back pain. And it's like every single paper that's comparing one type of exercise to another, it always shows, both of these types of exercise improve back pain. And that's consistent for every single one. It's like yoga, Tai Chi, Pilates, weight
Yeah,
training, walking, they all help.
yeah,
So find something you enjoy
yeah,
and then do it consistently. And that will almost certainly go a long way to helping.
yeah. I agree with that, and I try my best not to oversell the core strengthening thing, but rather just general moving and exercise. Um, I find really helpful.
I
Um,
totally agree. I think the
yeah,
core thing's quite hard sometimes as well. Like
yeah,
if you go to a Pilates class and everyone has a different way of switching on the core, if that makes sense. And it can be quite confusing. And people are like, well, should I always be like pulling my tummy in whenever I'm out and about walking or moving? And people can get a bit hung up on it. And I know I
yeah,
certainly did when I was first training.
yeah,
But then I realized that, any kind of exercise seems to really help with back pain. So it's finding something the person likes and that they can do consistently. And that's going to go a lot
yeah.
longer than any one
Enjoyment
particular
is important.
fix.
Yeah,
Big
cool.
time.
It's been a great discussion, Will. So yeah, so on that side, for patients who might want to reach out to you, how can we reach out to you?
Yeah, so I've still got my in-person practice in a place called Farnham, Surrey. That's called HT Physio. So if you want to Google that, then you'll find our practice. We've got some amazing physios there that help people with back problems every single day. They're far better than me. I deliver the training to them, and they help the patients mostly now. So that they do a great job. If you want to get a little bit more information about kind of my philosophy, then the YouTube channel is probably the best place to go. So again, HT Physio, it will pop up on YouTube, and we have about 4 videos every single week, easy exercises, just advice that people can follow at home if you're over
Put a
50.
link to that below. I highly recommend anyone watching to check out Will's channel. I watch it, for my own research as well. It's really good, really insightful.
Thank you. I really appreciate that.
All right, now thank you. That's been a really exciting discussion, Will. If you want to get in touch, there's links below to both Will's clinic and the Spine in DT for any further information. I'll put some of the videos that we've discussed as well on the links below. I hope you enjoyed that. You found that helpful. Thank you for watching.
Thank you, Anthony.